Good afternoon. Thank you, Lee. Thanks to AAMDS for the invitation, and thank you all for joining us today on this rainy fall Saturday. As Lee mentioned, I'm going to be discussing managing low blood counts, or what I like to talk with my patients about is really how to live a full life with low blood counts. My talk will be a little less scientific than the ones that you've heard leading up to this morning, but hopefully will be practical and provide some really helpful tips for day-to-day living. Even if you have normal blood counts with your diagnosis, I think I'll cover some helpful topics that will hopefully pertain to you. And at a minimum, I hope that some of the topics we'll talk about today will provide an opportunity or a prompt for you to talk about some of these things in more detail with your own healthcare team, because a lot of what you'll hear me talk about is that the answer will really depend on the depth of your low blood counts and other factors about your individual health. Okay, I'm going to just start out with some really basic definitions and terminology, which hopefully will be a review. If not, if I don't go into enough detail, please speak up during the Q&A. But first, we'll just talk about the different types of cells that we find in your blood. And I listened to the earlier presentations, and I know that these were all touched on to one extent or another. The first is red blood cells. Red blood cells contain hemoglobin, which is the protein in the blood that helps carry oxygen to the tissues throughout our body. Platelets help your blood clot, and white blood cells are very important in fighting and preventing infection. And white blood cells is kind of a generic term that's used to describe a number of different types of cells, with those specific cell types listed below, including neutrophils, which we'll talk about in a lot more detail, basophils, eosinophils, lymphocytes, and monocytes, and those all play different roles in helping your body fight infection. Basic terminology: when we talk about neutropenia, that means that you have a low neutrophil count. When we talk about lymphopenia, that describes a low lymphocyte count. Thrombocytopenia means that you have a low platelet count, and anemia generally means you have a low hemoglobin. That's the main measure that we look at when describing anemia. And that little cartoon at the bottom just shows you that the hemoglobin, which is the picture on the right, is on the red blood cell. And a lot of my patients ask if we pay a lot of attention to the red blood cell result on the blood report, and the answer to that is not really. We pay most attention to the hemoglobin and hematocrit levels when thinking about the depth of your anemia. These are more specific definitions of each of those terms that I just talked about. So a normal neutrophil count is generally over 1,500 or 1.5, depending on how your lab reports it, up to as high as 8,000. A neutrophil count less than 500 or less than 0.5, we generally call neutropenia. It may be reported on your lab report as an ANC, or absolute neutrophil count. The lower your neutrophil count, the higher your risk for infection. So when it's less than 0.5, we generally consider you at high risk. Those at highest risk have a neutrophil count less than 0.1 or less than 100. And a lot of my patients live actually with a neutrophil count as low as 0 for long periods of time. And those patients are really at the highest risk for life-threatening infections. And we'll talk more about how we prevent those things. Thrombocytopenia means a platelet count less than 150, which is the lower end of normal for a platelet count. You'll see some labs report 140, somewhere in that neighborhood, up to as high as 450. When your platelet count is less than 20 or less than 20,000, you have a higher risk for bleeding, or what we call spontaneous bleeding. So even if you don't have an injury or trauma, you can have signs of bleeding with a platelet count less than 20. And again, similar to neutropenia, the lower your platelet count, the higher the risk for bleeding. So we worry most about our patients with platelet counts in the single digits. Anemia. Normal hemoglobin is between 12 and 16 grams per deciliter, and the definitions of anemia still vary based on males and females, and that's due to the hormonal influences that start during puberty, where men have higher hemoglobin levels than women due to the impact of testosterone. So in men, hemoglobin less than 13.5 is considered anemic, and for women, the cutoff is less than 12. There's grades of anemia, and we'll talk a little bit more about that, with mild anemia being a hemoglobin between 10 to the lower limit of normal, and severe anemia being a hemoglobin less than 8. And generally, patients tend to feel symptoms when the hemoglobin is less than 8, but that can depend on how quickly you became anemic and how low the number is. So people who become anemic slowly over time may have less symptoms because their body develops ways to compensate, versus somebody who has a bleeding event, for example, and their hemoglobin drops quickly overnight. They may be much more symptomatic because their body hasn't had that time to accommodate to the shifts. So when you have bone marrow failure disorders like aplastic anemia or MDS or PNH, you can have abnormalities in one of the cell lines I just talked about. So in white blood cells, platelets, hemoglobin, or you can have abnormalities in all of them, or any combination. And those abnormalities can result from the underlying disorder itself, and or the treatment that we're using to treat those disorders can also cause the counts to be low, depending on the type of treatment that you're receiving. You may have less than the normal number of those cells, but we also sometimes see that patients can have normal number of those cells, but the cells may not function exactly as well as they would in a healthy person. And platelets are a good example of that. We can have patients with a platelet count of 60 or 70, but they may still report easy bruising or signs of bleeding like bloody nose, bloody gums. And that often gives us a clue that their platelets may just not be functioning as well as we would expect them to. There's not a good way to measure that function, unfortunately. So we do that just by a good assessment. So I'm going to go kind of cell type by cell type and just talk more about how we can prevent some of the complications that we can see when living with low blood counts, and how to just live as full of a life as possible. So we'll start with neutropenia, because I think that that's often the riskiest, because neutrophils are so important when fighting infection. We want to spend a good amount of time talking about how to prevent infection. We said that neutropenia is a decrease in the number of neutrophils, and that neutrophils are one type of white blood cell, but they're a very important type of cell in fighting and preventing infection. So remember, I said that the risk for infection depends on not only the number of neutrophils that you have, but how long you have been neutropenic for. So it's the depth of neutropenia, or how low the neutrophil count is, and how long it has been low. So if you have had a neutrophil count of 100 for many weeks, you are more at risk than somebody who's had a neutrophil count of 400 for a few days. So those at highest risk really have an ANC less than 100 or 0.1 for more than 7 days. So I'm going to go through some things that may seem very basic or common sense, but I don't like to skip over anything. One of the most important things that not only you, but your caregiver and your family members can do is maintain good hand hygiene. Hands are the most common way of passing germs and infection from one person to another. So hand washing really remains one of the most important things that you can do to prevent infections. Washing with soap and clean, warm running water for at least 20 seconds. Singing a song that lasts 20 seconds can be helpful, and then drying your hands afterwards. Prolonged moisture in any area of our skin can also promote infection. So we really want you to dry your hands as well. If you don't have access to a sink and soap, alcohol-based sanitizers are pretty much everywhere these days. So those can be used in its place. After you use the bathroom, we prefer washing your hands with soap and water is preferred over hand-based sanitizer. Your mouth is one of the dirtiest spots on your body other than your skin. So good oral health is a really important way of trying to prevent infection. You'll hear lots of different advice. These are really the most standard things that we talk to our patients about. So keeping your mouth clean, including brushing when you wake up and at nighttime as a minimum. Some sources will recommend that you brush after every meal, which I don't personally do. I don't know how many people are really that good at it, but it is a good way to make sure your mouth is clean after eating. You can also rinse your mouth after meals if you don't have access to your toothbrush in a sink. If you wear dentures, making really sure that your dentures are being cleaned regularly, at least before insertion. Again, it's recommended that they're removed and rinsed after meals. That can be really challenging depending on where you are in your day. Use of a soft toothbrush is recommended because it minimizes trauma to the gums, and the gums is one area of potential entry of bacteria into the bloodstream. So a soft toothbrush can minimize trauma. And it's recommended that you swap out your toothbrush every 3 months with a new one, just because bacteria can live and grow on our toothbrush as well. When selecting a mouthwash, you want to avoid commercial mouthwashes that have alcohol. Mouthwashes like Scope and Listerine are typically made with alcohol, which can be really drying in the mouth. And dry skin, dry mouth can also increase the risk of bacteria entry. So you want to use things that keep your mouth moist. So there are some mouthwashes on the market that are made not without alcohol. Biotene is one brand name, but they're all are kind of the generic versions of that are alcohol free. If you want to make your own kind of bland mouthwash at home, salt water or baking soda and water is also a nice way to just keep your mouth clean and are not irritating. And again, it's recommended that you do that after meals. And again, these seem very probably stringent, but these are for patients with low neutrophil count that may be at highest risk for infection. And I think we can each kind of take away from this some things that might be applicable to us based on your individual blood counts. We want to maintain flossing. If you're a regular flosser, that's not something you want to stop, and you may hear varying recommendations on that. But if you're somebody who has always flossed, you don't have to stop doing that because your neutrophil count, or even if your platelet count is low. Your gums are going to be most prone to bleeding if you don't floss. It may not be the time you want to take up flossing. If you've never flossed before and now your counts are low, it's probably not the right time to start. But if you're religious about it now, you can continue to do that to decrease the bacterial burden in your mouth. You want to avoid picking your mouth with things like toothpicks because that can create pathways to bacterial entry. And then avoid things that can irritate your mouth. As I mentioned, things that dry the mouth can increase the risk for infection. So things like alcohol and tobacco are two big offenders. And then the other things listed here are things that may just irritate the mouth. They're not likely to cause infection. Spicy food shouldn't cause infection, but it may irritate your mouth and just be uncomfortable. Along the same lines, you want to keep your lips moist by using lip balm. Any dry, cracked lips, again, might create a pathway for bacterial entry. Staying hydrated can also help with lip and mouth moisture. And then just checking your mouth regularly for signs of infection. And so these two pictures, the one on your left is a picture of oral thrush, which is an example of a yeast that can grow in our mouths. That's a common place for yeast to grow. Drugs like steroids can increase the risk for that happening, but good mouth care is one way that can help prevent that. And if you ever see anything like that in your mouth, you would want to bring that to the attention of your healthcare team. And there's medications that we can use to treat that. On the right there is an example of what we commonly call a cold sore, but is a herpes lesion. Those are very common. Many of us have the virus that's dormant in our body. And when our immune system is compromised, those viruses can show up in ways like cold sores on the lips. They can be very painful and tingly, and those are often the initial signs that one is going to erupt as you get this tingling sensation on your lips. And that is also something that we have medications that we sometimes use to prevent those outbreaks. And then we can also use medications to treat them. So those are two examples of things that you would want to monitor for and report if you see any evidence of that. A common question I get is whether it's safe to have dental work when your blood counts are low. The answer is it really depends on how low your counts are and what the dentist wants to do. I try to encourage my patients to keep their routine visits with their dentist, but make sure their dentist is aware of their blood counts. Talk to your hematology team about your blood counts and whether or not you need antibiotics or not before you see the dentist. Depending on what they're planning to do. But the dentist is one of our important partners in helping to decrease opportunities for infection in your mouth, looking for teeth that might be, may need to be removed, or other dental work that may decrease the risk for infection. So our skin is our first and primary barrier to preventing infection. So keeping our skin healthy is really important. So regular bathing and use of a mild soap, gently toweling off your skin after you shower, and keeping your skin moisturized is very basic, but really important. And I often find that a lot of patients don't have this in their routine for moisturizing their skin, which can minimize cracks and breaks in the skin. Using an electric razor instead of a straight razor to shave can also decrease the risk for trauma to the skin. Being careful when handling anything sharp, wearing gloves when gardening. We're going to talk a little bit more about gardening because that's a frequently asked question, but in this case, it would be to really protect your hands from cuts or trauma. Cuticle care. This is not a popular recommendation to avoid manicures and pedicures. What I say is make sure you're seeing trusted professionals who are cleaning their equipment according to industry standards, and that they're not aggressively cutting your cuticles. That's really where the risk for infection is really aggressive cuticle cutting and manipulation. So you don't have to avoid them altogether. Just make sure you're seeing trusted people who are sanitizing appropriately. Not picking, squeezing, doing anything to create trauma on your skin, and wearing clothing that's appropriate for the type of activity you're planning to do, like wearing long sleeves when you're doing activities that are more risky, like gardening. This may not apply to everybody, but I think it's really important to talk about central venous catheters in case anybody in the audience does have one. These are more long-term IV catheters that the tip of the catheter ends in the largest venous vessel in our bodies, which is the superior vena cava, which is why they're called central venous access devices. The three most common types of catheters are here with the Hickman catheter on the left. You can see sits externally with two catheter lumens outside of the body. The PICC line in the middle is a catheter that's inserted in the arm, and the PICC stands for peripherally inserted central catheter, where the catheter is tunneled up through a vein in the arm, and that tip goes all the way into the superior vena cava, which leads into the heart. And then the last picture on the right is an implanted port, which is entirely underneath the skin, and it's accessed by a needle from outside of the skin. Having one of these catheters does increase the risk for infection. Infection is the biggest risk associated with these catheters. However, many of our patients who are completely dependent on transfusions of blood and platelets need this type of device because the veins in their arms become worn out from repeated use. So there's many tips for patients who have these types of catheters to try to decrease the risk for infection. I won't go through every bullet of these in detail, but I'll highlight the most important. One is to ensure they're flushed at regular intervals. Hand washing, as I touched on one of the very first slides, is critical when you have a catheter like this, and minimizing touching and manipulation of the catheter as much as possible. When the catheters are flushed, there's a specific protocol for scrubbing the tips of the ends of the catheters to minimize infection. We do have patients who flush their own catheters at home, so teaching them to scrub for the appropriate amount of time is important. And I also empower our patients to make sure that any staff that are touching their catheter are also washing their hands and scrubbing the ends of the catheter appropriately. And then the other really important thing, if you have one of these catheters, is to cover them, the dressing and the catheter ends themselves, with plastic and then secured with tape while you shower. So water is a potential source of infection. particularly for patients who have a line like that and a low blood count, low neutrophil count in particular. So we really ensure that our nursing staff is teaching patients how to properly cover up their line when they shower to decrease the risk for infection. Pets is a very popular topic with my patients who have low blood counts and a lot of concern about not wanting to have to minimize contact with their pets. And of course, I never recommend getting rid of pets or minimizing contact in any way, but we want to just talk about strategies to decrease risk for infection. So the main risk for infection with pets is handling the pet's bodily waste. So the not fun things anyway. So the litter or picking up the dog poop on the walk. Those are things that you can delegate to other people. And if you don't have other people to delegate to, then our recommendation is that you wear gloves when handling it and wash your hands immediately after doing those things. Beyond that, you can have contact with your pet. You can pet your dog or cat. They can kiss you. Some sources will say they shouldn't kiss you on your face. Again, every conversation that I have with my patients is individualized. Some patients love to have their pet lick them on the face, and I'm not going to take that away from them. We talk about the risks and the benefits and come to kind of a mutual decision based on the individual patient. However, if you do get scratched or bit by your pet, that's something you need to call your healthcare team about quickly if you have a low neutrophil count, because you will likely be treated with antibiotics to minimize the risk for infection as a result of that bite or scratch. And of course, make sure your pet is keeping up with their checkups and vaccinations so that their health is maintained as well. Gardening with low blood counts is something that there are precautions that should be heeded, including use of gloves and a mask when your neutrophil count is very low, less than that 0.5 or less than 500. And that's because there is a good amount of bacteria and mold, especially in the soil, in leaves that have been sitting for any amount of time if you're raking leaves or mowing the lawn. So we do recommend a mask when doing those activities and gloves whenever you're planting or digging in the soil. Other environmental considerations include cleaning high-touch areas, things like knobs, faucets, places that you're going to prepare food frequently to minimize the risk for infection, telephones, things that other people are touching frequently. There have been many different dietary recommendations over time, and there's still a lot of institutional variability in what dietary restrictions are recommended for patients with a low neutrophil count. You may hear some recommendations that you should avoid all raw fruits and vegetables. That has really been dispelled for the most part as not being necessary. And what most sources are now recommending are following food safety guidelines that are outlined by the Center for Disease Control and is similar to what's recommended for pregnant women. And the reason for that is that the most common foodborne bacteria are things like Listeria, norovirus, Salmonella, and those types of bacteria are commonly found in some of the foods I'll be talking about. And these are the foods that generally need to be avoided. And again, I'm really talking about the most immunocompromised for some of these avoid foods, including raw and undercooked meat, processed and cured meats, smoked foods, raw fish and shellfish, and raw and undercooked eggs, as well as salad bars, buffets, and potlucks. And these are really the primary sources for those types of foodborne illnesses, as well as unpasteurized products, including dairy products and honey and juices that are not pasteurized. Some other useful tips that can really be useful for all of us, including avoiding things that are past their use by or expiration dates and avoiding leftovers that are older than 48 hours. The CDC has a really robust website with very specific recommendations for this group of patients. So I'll direct you there if this is a topic that you're really interested in. And I didn't include this to kind of read to all of you, but more just an example of the resources that are on their website. So they have kind of riskier food choices based on the category, and then the kind of alternative, safer choice in that same food group. So I really encourage you to go there if this is a topic that you're interested in. I included just some general safe food preparation guidelines to decrease the risk for infection. So of course, it always goes back to hand washing before food prep. Thoroughly rinsing fresh fruits and vegetables under warm running water. So it's no longer avoid fresh fruits and vegetables, and it focuses more on washing things well. Things that can't be washed well should be avoided raw. So things like broccoli is really hard to thoroughly wash, but you can eat that cooked. You want to scrub or brush produce to remove excess dirt, and even things that you're going to peel, you should wash first to avoid introducing bacteria while cutting it, using separate cutting boards for meat and produce, and avoiding wooden cutting boards, and not reusing a dish that's had raw meat or fish. There are some food storage guidelines and recommendations to minimize the risk for infection, including avoiding keeping food on the counter for longer than necessary, not thawing or defrosting food on the counter, but doing that in the refrigerator, and ensuring that your refrigerator is set the appropriate temperature of 40 degrees. And refrigerating and freezing food immediately after purchase are some good tips to decrease the risk for infection. And again, a lot more detail on those topics on the CDC website. I get a lot of questions about activity and what's safe when your counts are low. And again, I do really try to tailor that discussion to my patient and their values and talk about risks and benefits. But these are some general guidelines, avoiding crowds in enclosed or small places, planning activities for less busy times. So it doesn't mean you can never go to the movies, but you don't want to go opening night on a Friday night at 8 o'clock. You want to go to the movies on a time when it's not as busy. You guys all did a lovely job of kind of sitting apart from each other. And this auditorium is similar concept. If you're going to go to a movie, you want to go at a less busy time where you can kind of be off to yourself and have more space around you. Don't go to the grocery store on Saturday morning at 10 o'clock. Go during the week at a time when it's not as busy. Avoid sick contacts when possible. And I mean when possible, because obviously if you're living with someone and they're unwell, it's hard to avoid them altogether, but you want to use some of the tips we've already talked about, like good hand washing, physical separation for the time when catching the infection is highest. Wearing a mask has become a lot more commonplace. So wearing a mask when in kind of enclosed places, like elevators, for example. And then common things like don't drink out of the same cup as someone else, don't share utensils or toothbrushes. So intimacy is something that my patients often want to talk about, but are often reluctant to bring up with their healthcare team. So I won't spend a lot of time on this, but do want to just say that it is important to talk about if it's important to you. And I want you to feel empowered to bring this topic up with your healthcare team, whether it's your nurse, your doctor, your nurse practitioner. And it really can be a conversation that's more tailored to your particular situation and questions. But I want to just generally say that there are ways to make intimacy safe when your blood counts are low. And safe sex can decrease the risk for infection while you're neutropenic, but there's also considerations around bleeding when your platelet counts are low that we need to talk about. I have had patients have bleeding complications because they weren't well prepared before their counts were low. And we kind of had to talk through things in the midst of a difficult complication, which isn't ideal. So that's the other reason that I think it's important to bring it up today. So if you're of childbearing age and you have a diagnosis that will include having low blood counts or will include treatment that may result in low blood counts, family planning is a really important topic to discuss with your healthcare team before you start on any treatment. So that you understand the risks and you also understand options that can be discussed before treatment is started. With any type of penetrative sex, whether we're talking about oral, anal, or vaginal intercourse, the risk for bleeding is highest when the platelet count is less than 50. And again, the risk goes up the lower the platelet count is. And the risk for infection is highest when the neutrophil count is less than 500. So using barrier methods, including condoms and dental dams, are important considerations, and use of water-based lubricants can decrease the risk of both bleeding and infection. So we'll shift gears a bit and just talk about ways to monitor for infection. Hopefully everyone has a working thermometer and knows how to use it and keep it in a convenient location. I don't recommend that my patients check their temperature kind of multiple times throughout the day. I more try to teach them to check their temperature if they're not feeling well, if they're feeling warm or cold. Those are the times you should check your temperature. I don't recommend checking it more than once a day because I don't want people to feel kind of married to that routine. But also have your healthcare provider's number handy at all times. And if your neutrophil count is less than 500, what we consider a fever is a temperature of 100.4 degrees Fahrenheit or more. That's our number that we advise that you call your healthcare provider, regardless of the time or day or night. That's the number you should call for. There may be some institutional variability around that, but if you're immunocompromised, it's never a bad idea to call sooner rather than later. I tell my patients, if you're calling after hours and you don't get a call back in 20 minutes, keep calling until you get a call back. Prepare for possible admission to the hospital for IV antibiotics, as we consider neutropenic fever an emergency, because you need IV antibiotics to protect against potential infection in the absence of a healthy neutrophil count. So we do consider what we call neutropenic fever an emergency, and ask that people behave as such and call us right away. Other signs and symptoms to monitor for, including shortness of breath, cough, chest pain, any signs of an upper respiratory infection like cough, nasal congestion, runny nose, sore throat. I tell my patients, if you're worried about something that's new or different, just call. That's what we're here for. Let us help you figure out if it's something to worry about or not, rather than wait until it's really and obviously something that's a problem. Let us walk you through whether it's something we need to keep an eye on, or whether it's something that could be related to another problem. Uncontrolled nausea, vomiting, new abdominal pain, changes in your bowel habits, anything, any pain or redness on your skin may be a sign of infection, particularly if you have one of those catheters that I showed, any pain at the insertion site, any new rashes or sores that aren't healing, changes in what your urine looks like or smells like, or any unusual discharge may be signs of infection to bring to your healthcare provider's attention. I mentioned earlier, there are medications that we may use to prevent infection, and this really depends on how low your neutrophil count is, your underlying diagnosis, and whether or not you're on active treatment. So there are medications that can prevent infections, viral infections from the herpes virus. Drugs like acyclovir or valacyclovir are common examples. Antifungal medications that can prevent infections by fungus. We tend to use these only in patients that have very low neutrophil count for a long period of time, like those patients that I gave the example of the neutrophil count of 0 for many weeks. Those are the patients we would use antifungal medications in. And then we do, some patients we use antibiotics to prevent bacterial infections with drugs like moxifloxacin or levofloxacin. And as I mentioned earlier, use really depends on the depth and duration of neutropenia, your underlying diagnosis, your age, other medical problems. Okay, I'm going to shift gears and talk about living with low platelets. So thrombocytopenia is the word that we use to talk about platelets being low. And as mentioned earlier, the platelet count less than 20 is kind of the cutoff for an increased risk for spontaneous bleeding, with those at highest risk really being those with a platelet count less than 10. Some activities, simple things we could do to modify the risk for bleeding. Again, minimizing trauma to the skin is one way. So using an electric razor instead of a straight razor, using a nail file instead of nail clippers. I tell my patients to avoid nose blowing when their platelet count is very low, not putting anything in your nose. Nosebleeds are one of the most common problems in my patients that have a platelet count less than 20. So prevention is one of the strategies that we talk about. So 2 easy things we can do to decrease the risk for nosebleeds is keeping the air at home humidified, especially in the colder months when we have the heat on, the air can get really dry. So humidifying the air and using nasal sprays like saltwater sprays or gel can also keep the nose moist, and that moisture helps decrease the risk for bleeding. If you do experience a nosebleed, pinching the nose and leaning forward is the recommendation. And if it doesn't stop after 20 minutes of direct pressure, that would be an indication to call your healthcare team. And there's other things that we can do. There's a medication, the brand name is Afrin, but squirting Afrin in the nose can decrease the bleeding by constricting the blood vessels in the nose. And sometimes we have to give platelets to help the nosebleed stop. And in severe nosebleeds, we have to call our ear, nose, and throat colleagues to help. If you have a cut or an injury and your platelets are low, you want to put direct pressure on the area. And again, I generally tell my patient if the bleeding isn't stopping after 10 minutes, or you're saturating through, pads of gauze, then you want to call or go to the nearest emergency department. Using a soft toothbrush I mentioned earlier can minimize trauma to the gums, which can decrease the risk for bleeding. And we want to avoid high-risk activities. Again, this is something that's a patient by patient discussion, but contact sports would be something we would want to think carefully about when your platelets are low, riding a motorcycle, getting on a ladder or a roof. Again, are they absolute no's? No, but it really depends on your platelet count, how low it is, how long we think it's going to be low for, and whether or not it's realistic to avoid those activities. But you always just want to think about risk for injury and the depth of the thrombocytopenia. Falls can be very dangerous when your platelet count is low, and this is a frequent cause for serious bleeding in this population. So I always talk about decreasing our risk for falls by assessing your environment at home for things that can contribute to falls, like throw rugs, areas with low lighting, trying to stay active and maintain strength and balance with exercise, walking, and things like yoga and Tai Chi can really help with balance and strength, and has been shown to decrease the risk for falls. If you're deconditioned because of the treatment that you're on or have experienced, physical therapy may be an important member of the team to help maintain your strength and balance. And then sometimes, we haven't talked about anemia yet, but sometimes when you have severe anemia, you can feel dizzy, and that's a risk factor for falling. So we really want to minimize anything that's contributing to dizziness to minimize the risk for falls. If you ever have a fall or any type of injury and your platelets are low, I always advise you talk to your healthcare team right away to talk through the risk for injury. Avoiding drugs like ibuprofen, or that's in a group called NSAIDs, or aspirin, or similar medications when your platelet count is very low, because those interfere with platelet function. So they may increase your risk for bleeding. There may be situations where you may need to be on blood thinning medications because of other medical problems like blood clots or atrial fibrillation. That's something that your hematologist should be involved in the discussion about the safety of those type of medications, again, based on your medical problems and the depth of your neutropenia. Herbal and over-the-counter substances also need to be used with caution, as there are some that can interfere with platelet function, and a few examples are listed on the slide, including St. John's wort being one of the most common offenders. Signs of bleeding can be things that you can see, like nosebleeds, bleeding in the mouth and gums, really dark stool, like black colored stool, or blood on the stool, or blood in the urine. A new severe headache would be a concern, or changes in vision. Those are all things that you should bring to the attention of your healthcare team. I know these were mentioned earlier in the earlier talks, but there's a picture on the left of petechiae. Those are signs of small bleeding under the skin, most commonly seen in the lower legs or the arms first, and then can be seen on other parts of the body. And then on the right, there's signs of bleeding in the mouth when you have very low platelets. We typically see these when the platelet count is less than 20. You can get these purple spots in the mouth. So if you see any of these may suggest that your platelet count is very low, and again, bring to the attention of your healthcare team. Platelet transfusions are a strategy for patients that have very low platelet counts, and the parameter for platelet transfusion really varies by institution. Some use a cutoff of a platelet count of 20 or less to transfuse. Others use a platelet count of less than 10. Others only transfuse if you have signs of bleeding. So you may see some variations in that, but platelet transfusions give your body platelets as a way to decrease your risk for infection. Because you're receiving platelets from other donors, you may have a reaction to those platelets that can look like allergic reactions. You can also, there is also risk for infection from platelet transfusions. So if you ever experience a fever or chills during or after your platelet infusion, that would be important to bring to the attention of your healthcare team. Quickly switching to anemia. Anemia is when your body doesn't have enough hemoglobin or red blood cells. Again, it can be the result of the underlying disease and its treatment. And when your body doesn't have enough red blood cells, you may feel tired, weak, short of breath. Other signs of anemia can include dizziness, a racing heart, chest pain, feeling cold, trouble concentrating. And again, if you've become anemic kind of slowly over time, you may not have any symptoms at all. And other patients may be very symptomatic. Fatigue, anemia is a common cause of fatigue. However, it's not the only cause of fatigue. So even when we fix or improve anemia, some patients still feel fatigue. So I like to bring this up just to say that fatigue is a really complex symptom, and we have to really think about all of the reasons our patients are feeling fatigued, and not just focus on anemia, but focus on all of the other things that may cause fatigue, and try to improve as many of those things as we can. I included a definition of cancer-related fatigue just because it's an kind of a definition that's evidence-based and is included in a lot of the studies on fatigue. But this is obviously a subjective phenomenon, and we have to take our patients' experience and report of how bad their fatigue is at face value. So we can use a 0 to 10 scale to describe fatigue, just like pain, with 0 being no fatigue and 10 being the worst fatigue ever. And this is a way that you can talk to your healthcare provider about how bad your fatigue is. And in studies, a score of 7 or more has been correlated with decreased activity and function in patients who have fatigue. I mentioned there's other reasons for fatigue other than anemia, although the focus of this will really be on the anemia piece. So our primary recommendations are to balance energy conservation or rest with activity. So taking advantage of the times of day that you have the most energy, and doing the things most important to you during the times when you have the most energy. And that might vary from day to day or might vary over time. Asking for help is also something that most of us are not very good at, but can be really important when you're dealing with and living with anemia and low blood counts. So when my patients are newly diagnosed or going through different challenges over the course of their illness, I ask them to come up with a list of things that they either don't like to do, can't do because of how they're feeling, or are easy to ask other people to do. So that when the people that are around them reach out and want to help, they have a ready list to say, here's how I can, here's how you can help me, which again, it's not easy to do. And you can ask your healthcare team, and our nurses are great at helping people come up with ideas, but try to identify at least a few things you can have other people help you with. Listen to your body and rest when you feel like you need it. Taking short naps when you're really feeling fatigued. And this is, there is evidence to support that longer naps can be counterintuitive. So it's really recommended not to sleep for more than 30 to 60 minutes during the day, which I know is difficult, but that's really where it can become counterproductive and may contribute to more fatigue if you're spending more than an hour during the day sleeping. Getting sufficient rest at night is really key, with ideally getting 8 hours of sleep a night. And I'll talk quickly a little bit more about that. Regular exercise is also what we call a level 1 category for combating fatigue. So that means that there are studies that support that regular exercise can decrease fatigue. The amount of exercise is not, there's not a gold standard for how much exercise it takes, but it's recommended that 30 minutes most days of the week is ideal. You can break that 30 minutes up throughout the day into 10-minute increments, so it doesn't feel so overwhelming, but that can make it easier to fall asleep at night and can decrease daytime fatigue. Making sure you're drinking enough. So dehydration is a common reason my patients feel more fatigued. So staying hydrated can be helpful. I talked about a few tips related to exercise, one being breaking it up into smaller increments. I think it's really overwhelming when your healthcare provider tells you to exercise and you think it has to be like getting on a treadmill and running a couple miles. I tell my patients, start with walking back and forth to your mailbox a few times. That's exercise. If you're going from doing nothing, you have to start somewhere. And then hopefully over time, we can build and go beyond the mailbox and go around the block and build on that day over day. Making exercise a social activity can help with motivation. And working with your team. If you're having other symptoms like nausea, it's really hard to think about exercising if you're nauseous and throwing up. So making sure that your other symptoms are well managed. Yoga is another activity that is evidence-based in helping sleep and fatigue. So doing yoga a couple of times a week has shown to be helpful in combating fatigue and sleep interruption. So a few tips around sleep include coming up with a consistent routine. So going to bed at the same time every night, not staying up later on the weekends, keeping your bedroom quiet, dark, set at a comfortable temperature. This is hard, but removing all your devices from the bedroom and really just dedicating your bedroom to sleep and sex and not any other activities. Avoiding large meals and especially caffeine and alcohol before bedtime. Those can be really disruptive to the sleep cycle, and not exercising too close to bedtime. Exercise can also be really stimulating. So try to get your exercise in, not within an hour to 2 of bedtime. And then try to develop a bedtime routine that's relaxing. Other things to help with fatigue that I haven't already touched on: pace yourself, set priorities and realistic expectations for what you can do, schedule activities at the time of peak energy. We talked a little bit about that. Postpone things that aren't essential to when you're feeling better. Try not to multitask. That's another hard one, but multitasking has also have evidence to show that it can be very stressful and can contribute to fatigue and difficulty concentrating. Work with your healthcare team to look at your medications to see if there's anything that can be adjusted that might be contributing to fatigue. And unfortunately, there's not enough data to recommend stimulants to combat fatigue. Drugs like Adderall, Ritalin don't fall into the category of things that can be helpful for fatigue. Blood transfusions can help when your hemoglobin is very low. A restrictive transfusion approach, meaning transfusing for only patients with a hemoglobin less than 8, is recommended for the general population. There's a real lack of consensus around patients with bone marrow failure disorders and aplastic anemia and MDS for what the right cutoff is for transfusion. I would say a generally accepted approach is to start thinking about a transfusion when the hemoglobin's less than 8, but talk to your patient about how symptomatic they are and come up with a decision together about when the right time to transfuse is. There's no evidence that 2 units at a time is better than 1, so we try to only give 1 unit at a time. And if you have a history of heart problems, we may need to use a higher hemoglobin threshold for transfusion. I think Dr. Anton touched on this a bit. You know, your heart, if you have heart problems, having anemia really taxes your heart, so we may want to keep the hemoglobin at a higher level. And we do recommend patients who are transplant candidates to have their blood products irradiated to minimize exposure to white blood cells and antigens on the donor's blood. And Dr. Anton touched on that a bit also at the end of his talk. Similar to platelets, red blood cell transfusions do carry some risks, including allergic reactions, volume overload, iron overload, which I think some of our earlier speakers touched on. And there is very low risk for infection with red blood product transfusions of getting infections from the blood product itself, with the incidence listed here of transfusion-related infections. With HIV, it's a 1 in 2 million chance of transmission from blood products. With hepatitis B and C, it's a little more frequent, though still very unusual. And West Nile virus, the incidence is about 1 in 350,000. The risk for infection from platelets is much higher. It's about 1 in 2,500. And with platelets, it's riskier. The risk is for bacterial infection. That's why it's so important with platelet transfusions, if you have a fever or chills, that you report that promptly. With red blood cells, it's much less common that you're actually infected from that blood product. A few other commonly asked questions which may come up in the FAQs, but alcohol, is that safe with low blood counts? Again, this is really something I talk to the patient carefully about. How much are we talking about? How often? What is your liver function? What are your other medical problems? What medications are you on? It's generally not an absolute no, depending on your medications, but something that you should talk to your healthcare team about. Driving, there's no standard contraindication to driving with low blood counts. However, if you're having symptoms like dizziness, you need to use your judgment and discretion and not drive at times that you're feeling a lot of fatigue or dizziness. Sun exposure, you may be at increased risk to sun sensitivity depending on what medications you're on. So again, talk to your healthcare team about that. And vaccines are an important way to decrease the risk for infection. Patients with immunocompromise can safely receive inactivated vaccines. Inactivated vaccines are not live vaccines. Shots like the flu shot, COVID shot, RSV shot, those are not live vaccines. Those are safe to get when you're immunocompromised. However, depending on your individual situation and blood counts, you may not respond to the vaccine in the same way that a person with a healthy immune system would. So you just may not get the same benefit from the vaccine as somebody with a healthy immune system. We generally still recommend that our patients get the flu shot and the COVID shot, even though we're not sure they would benefit from it. We hope that they'll get some benefit from it. Live vaccines are vaccines like measles, mumps, rubella, the shingles vaccine. Those generally should be avoided in patients who are immunocompromised. Again, you want to discuss these with your healthcare team who know the details and the extent of your immunocompromise and can give you the safest plan. If a household contact needs a live vaccine, that's also something you should discuss with your healthcare team, because for some time, the family member that gets that vaccine may shed live virus, and you may need to just avoid their sharing a bathroom or changing a diaper if it's a child. So that's something else to keep in mind and bring up to your team. I'll pause there. I know I went over a bit. But thank you for sharing your Saturday with us. And I want to just thank my patients, because all of their questions challenge me every day to come up with the best answers. And hopefully I've shared a lot of that with you today. So thank you.
Here we go. Hang on that way.
I'm going to take a sip.
There you go.
I just have one question, because you mentioned quite a lot neutrophils and ANC, and I get CBC done every week, but where do I find that information? I don't see anything that reports ANC.
Great question. So everybody's blood report looks a little bit different, but usually you will get a total white blood cell count, and then somewhere lower down on the report, you should see neutrophils, basophils, all of those different white blood cells I mentioned, neutrophils, lymphocytes, and it may report it as a percentage, and then we have to do the math. So if it says that you have 40% neutrophils and your total white blood cell count is 1.0, then 40% of 1.0 is your neutrophil count. And you, if maybe offline, I could look at your report and I could help you figure that out. But usually there's a breakdown towards the bottom of the complete blood count that gives you the breakdown of how many of those white blood cells are neutrophils, lymphocytes, eosinophils, basophils, monocytes. That's usually found lower down on the report.
I didn't know what I was looking at.
Yeah, if it's not reporting the absolute count, it may be reporting it as a percentage, and then we have to do the math. Great question.
Anyone else have a question in the room? Okay, and we did not have any online,
Okay, I
so
know I
yeah.
covered a lot quickly, so hopefully your
it was a
minds aren't spinning around. but-
wonderful presentation. And thank you so much, Lisa, for coming today and sharing your time and your expertise with all of us today.